Hello everyone, welcome to the channel. This is Doc ID. I'm an infectious disease physician in the US, and today I am going to talk about guidelines for pregnant women with suspected coronavirus disease infection. This was an article that came out in the Lancet of Infectious Diseases. This was done in 4 different countries, which included the United States, Switzerland, China, and France. Don't forget to subscribe and hit that notifications button to get the latest updates on coronavirus disease as it comes along. So coronaviruses are responsible for SARS and MERS that can cause severe adverse pregnancy outcomes, which included miscarriages, premature delivery, intrauterine growth restriction, and maternal death. Vertical transmission has not yet been detected in coronavirus 2, whereas perinatal transmission has been suspected in 1 case. Vertical transmission, again, is clinically when the infection is directly from the mother to a embryo, fetus, or baby during pregnancy or childbirth, which we did not see in coronavirus 2. And perinatal transmission is before and after birth, the period, that's what it is. So consequences of this infection with SARS coronavirus 2 for pregnancies are uncertain, but we have seen no evidence of any severe outcomes for mothers and infants in, again, coronavirus disease 19. But we do need recommendations for management of pregnant women at risk, as the possibility does exist. And that's why this guidelines that came out of these combined authors from 4 different countries should give us some sort of a direction to go on. So in this algorithm, the authors suggest that any pregnant woman who has had close contact with a person with the coronavirus 2 disease needs to be tested even if they are asymptomatic. If they become positive and asymptomatic, then the patient is recommended to self-quarantine herself for 14 days. If the patient becomes positive but has mild illness, it is recommended that during their pregnancy they get monitored with bi-monthly fetal growth ultrasounds and Doppler assessments. If the pregnant woman ends up getting pneumonia, then they do recommend that the patient be transferred to a tertiary care center. And if that patient ends up having multi-organ failure or what we call sepsis, they should actually be treated out in the ICU. So again, this is the algorithm that these authors came out. Again, you'll have to be really kind of talking with your OBGYN regarding these issues and bringing this up and kind of work closely with them as well. But this is a little bit of a kind of a guidelines as to if you have a contact with the person with the coronavirus. So another question would then come up is the choice of delivery timing. So whenever possible, vaginal delivery via induction of labor with eventual instrumental delivery to avoid any maternal exhaustion should be favored to avoid unnecessary surgical complications in an already sick patient. If the patient has septic shock, acute organ failure, or fetal distress, that should actually prompt an emergency cesarean section. Newborns of mother positive should be isolated for at least 14 days or until viral shedding clears, during which time direct breastfeeding is actually not recommended at that point due to exposure, not from the breastfeeding itself, but the exposure to the baby from the mother having close contact. So I hope you guys enjoyed the lecture today. It is we have very limited data on the guidelines for pregnancy. More studies are going to come out as time goes on, but up till now, this is the information that we have right now to go on. And again, pregnant women need to follow with their OBGYN recommendations, as they are more up to date as time goes on as to how to handle a patient with coronavirus disease. This was just an article that had come out. So don't forget to subscribe. We have some more interesting talks coming up. Hopefully the next one's going to be about immunity, which should kind of lead us a little bit on this vaccine that's coming out and understanding it a little better. Feel free to comment below. And till then, I will see you next time.